Welcome to our community broadcasting network featuring the Health and Wellness Best Practices podcast. Our guest today is Colorado State Senator for District 21, Dafna Michaelson Jenet, who serves as Vice Chair of the Senate Health and Human Services Committee. She will share how the Health and Human Services Committee works, as well as healthcare issues that are prioritized for the 2026 legislative session. Senator Michaelson Jenet, thanks so much for being back with us. It's great to see you again.
It's great to be here. Thank you for having me.
When you were in the House, you were the chair of the Health and Human Services Committee there. In the Senate, you are the vice chair of Health and Human Services. And an awful lot of work gets done in that arena. I'd like for you to kind of explain exactly what you guys do and kind of the process a little.
Yeah, committee work is amazing because we take the ideas that come from legislators and we help mold them into legislation that will serve the people of Colorado. And the way it works is a legislator has an idea and they draft that idea into a bill, a draft bill. And that bill is then assigned to a committee. And it's assigned to a committee of reference that is an expert in the area that that bill covers. So for me, it's Health and Human Services. And the health bill, I'm going to use my SNAP bill as an example. I passed a bill to put LL and MM on the ballot to both cover the Healthy School Meals bill and the SNAP shortfall that we're going to experience, or we're experiencing already. So the bill was an idea, and it got drafted by the attorneys in the basement. And then the bill was routed to Health and Human Services. And in Health and Human Services, we discussed the content of the bill and any amendments that might need to be made or changes that might need to be made. Lots of that happens in committee. So the bill was discussed by the members and then voted on by the members of the committee. And with a majority vote, it moved on to the next level, which is going to the committee of the whole. The entire 35 senators discussing the bill and discussing whether or not they want to pass it on a voice vote. And we passed on a voice vote. It was party line, but we passed. And then we moved on to third reading of the bill, which is when the president stands in front of the whole body and asks for your vote. And in the Senate, we raise our hands, yes or no. And it passed in the Senate as well, with a party line vote. And then it moved on to the House where it went through the same process.
Now, because there is an increase in taxes to pay for this, it did have to go in front of us voters to give final approval. And this past Tuesday, both propositions passed with really solid margins. When Senator Judah was on, I asked her, what people could do to get involved. And she said that, it's really important for people to consider testifying to the Senate because it's the people that have the most at stake that understand the issue the most. Is this something you do in committee? Or does this go to the whole Senate? How does that kind of get coordinated?
Yes, community testimony happens in committee and is extremely important. I was just speaking with a Republican colleague of mine who was listening to testimony in a committee and it changed his mind. He ended up voting yes on the particular bill because of the testimony. And we need people to know that real people with real stories is what changes people's minds. So if you want to impact legislation, you need to come with your story, whether you want to kill the piece of legislation or you want to pass the piece of legislation. Your story is what will make the difference.
Okay.
And let me tell you a little bit about testimony. In the Senate, it's about 3 minutes. I think it's in the House too. So I highly recommend that people write up their testimony in advance and answer the question, who are you? What do you want to happen? What is your ask? How do you want it to happen? And who will be impacted? So if you can answer those 4 questions in 3 minutes, you will have moved the committee to vote possibly in the way that you are asking.
We're going to talk again as we continue on with these types of programs about priorities, especially once you're in session. Are there any initial priorities that you're looking to introduce in the first part of the next session in 2026?
Absolutely. First of all, we already introduced the LL and MM measures to keep kids in school fed and to fill the gap for SNAP, the Supplemental Nutrition Assistance Program for people who are getting help with food for their families. We anticipate about 300,000 people losing insurance or coverage under this HR1 bill. So we are also working to figure out how do we keep people taken care of when we don't have the funds coming in from the federal government that we need to support that. So we've been working directly with counties who will bear the brunt of this distress. And we're hoping that we are coming up with programs with the creativity of the people at the county and the creativity of the people at the state that will help keep people insured and keep people fed. That is our number one concern right now.
Well, you know, everybody is aware of Medicaid and the crisis we're dealing with right now in that, and it's certainly anything but resolved. But where exactly are we at right now?
We're in a very precipitous place. I would say people don't understand Medicaid. Medicaid goes to people who are working but don't make enough money and don't get insurance coverage from their employers, like many people who work at Walmart, for example, are covered by Medicaid. It's important to know that when we talk about losing Medicaid, we're not only talking about unemployed people who also deserve to have health care, but we are talking about working families, some who work 2 and 3 jobs and cannot afford insurance. Medicaid makes sure that we keep a baseline of health in our community so we're not dealing with crisis after crisis. I used to work at Denver Health many years ago, and we were trying to train people not to use the emergency department as their primary care physician. And Medicaid makes that possible because with Medicaid, you can get an annual physical for no copay and no coinsurance, just like you can on ordinary insurance. So Medicaid acts as state insurance. So you are actually on a plan where you can get coverage for primary care treatment, secondary treatment, surgeries, things that you need so that you don't end up in crisis. We are going to see our community end up in crisis if 300,000 people fall off of Medicaid. We're and SNAP. They're going to be hungry and they're going to be sick. So I think what's going on in Washington with HR1 is cruel and really aims at hurting the least amongst us. And it is our duty as a community to reach out and care for our neighbors. And this is a program that cares for your neighbors. Your next door neighbor might be on Medicaid and you would have no idea. And we're taking away their health care. That's not right.
No, it's not. And one of the real interesting facets of the system, and again, just so people understand, because it is easy to confuse Medicare with Medicaid. Medicare is what people over 65, like myself, have for health insurance. That's one thing. Medicaid is a program that is funded as a collaborative between the federal government and the state. Now, the state of Colorado actually creates a lot of the rules for Medicaid within the state. And the federal government has some basic overview rules about Medicaid. Are those going to change with this funding cut? I mean, that's a mess, I think.
Yeah, it's a big mess. There are significant rules that come down with receiving federal funding for Medicaid. And we have to follow them. And yet we get really creative in Colorado in the things that we're able to cover and we're asking to cover. One of the things we just lost, which I'm devastated about, is no prior authorization for therapy. Now, if you want therapy, you need prior authorization on Medicaid, and that is very cumbersome because now you need to make an appointment with a primary care physician, and then if they say so, you can have therapy. We had gotten rid of that step. And getting rid of that step made access to therapy more available for our Medicaid clients. And now they have to jump through that loophole once more. But the question I'll have for our Medicaid director when we get to session is, if we're not getting federal dollars, do we have to follow federal rules? That absolutely needs to be answered, because without that federal webbing around what we can do, I think there's more ways that we can reach out to our community and provide care with the dollars we do have.
So it is really crucial to come up with some creative ideas in order to help people that really need the help. And one of the things from one of my past interviews with the Colorado Disability Coalition, I learned how critical people with disabilities depend on Medicaid to live independently. And if that gets to be too cumbersome and unable to get services when needed and things of that nature, a lot of these people are no longer going to be able to live independently, and they're going to have to be in institutions. That's going to be a huge cost.
That's going to be so much more expensive than providing them with Medicaid. And these are questions the state is going to have to answer, because the state is going to bear the cost. So if we can't keep our disability community living independently, we are in bad shape.
Yeah, exactly. Well, again, I tell people I learned so much doing this podcasting on issues because it is complex, and we don't get a lot of really good information out. I don't believe, to the public. And that's why I, kind of built this platform. You and I talked about, and I want to be able to finalize this about, coming on once a month and hosting a kind of an update podcast of what you're doing in the legislature, and be able to bring on other legislators that have expertise in certain areas. And boy, oh boy, I depend on you for this kind of information in a major way. So I just want everyone to know how much I appreciate you willing to donate your time. We'll get our initial program up before the start of the 2026 legislative session, and then we'll start tracking from there. Does
That
that sound
sounds
like a
great.
great idea?
Yeah, I think we'll have some really great conversations that talk about what it matters to our community members right now.
Okay. Well, Senator Michaelson Jenet, I just so much appreciate you and your expertise, and I think people really do recognize you as a significant leader in our legislature, and you really do get things done. And that's what really where rubber hits the road. So you want to give us any final thoughts today?
Yeah, final thoughts. Don't panic. We are working on solutions. And if you need help, reach out to my office, 720-675-9551. And reach out. You'll reach my aide, Haley, and we'll take your information and try and get help to you.
So, again, thanks so much for spending time to be with us today. And I look forward to our new segments that are going to be a little more focused on what you're doing specifically in the legislature on the health and healthcare issues. So, thanks for being with us.
Thank you for having me.